Welcome to Deuk Spine Institute. I'm Dr. Deuk Majan. You can see from the x-ray we've just taken, we are performing spine surgery in the lower back. This patient has facet joint pain. Facet joint pain is a type of arthritis pain that causes back pain. It's responsible for about 8% of all back pain as the primary cause, the main cause, without anything else being the main cause. But it's present in about 45% of patients with chronic back pain. Now, the major cause of chronic back pain is the disc, and this patient definitely has disc pain. We just fixed his L4-5 disc shot. Not bad, huh, Jordan? So you think that's 3? Yes. I agree. Yeah, I just need to go more medial. This patient has disc pain. We just fixed it at L4-5, and you could check out our YouTube video a little earlier and see. And now we're fixing his facet pain. So I've got to deaden the pain nerves here in his back, and that's what I'm doing right now. Any questions, feel free to ask. But Henry, go ahead and show our audience. That's the perfect position of our probe, by the way. Doesn't get any better than that. Henry, show our audience a video on how do these facet joints cause so much pain anyway.
Copy that.
Okay, great. So now you guys have seen how do facet joints cause so much pain. The answer again comes back to what we've been saying for a long time, inflammation. And when it comes to facet joints, they're just like your knee or shoulder. They can become injured with trauma, and then they hurt really bad. And the treatment is to get rid of the pain in the joint. And the way we do that is through basically deadening the pain nerve. So what I'm doing is I'm using the x-ray machine that you guys are seeing. I'm using those picture shot to find the pain nerve and deaden it. And there's a name for this nerve. It's called the medial branch of the dorsal ramus. And as a neurosurgeon, which is my training, you know where these nerves are, and I know now how to destroy them. We are normally taught as neurosurgeons how to not destroy nerves, but there are times when you need to destroy a nerve, especially when it's a bad nerve. Shot? Jordan, give me that 5-1 better. So this is a nerve that literally all it does is cause pain. Am I in the right spot? It looks like I'm pretty close. Probably could be a little more medial, but that looks really good, right? Huh? Shot? Uh-huh. That's like perfect right there. All right, any questions about destroying pain nerves to the spine?
We have a question and a comment. These comments coming from WD, once more on YouTube.
Sure, WD, happy to take it.
From the last live stream, they mentioned that Keystone Heights is about 30-40 minutes outside of Gainesville.
Okay, right.
And WD-40, it took them 40 attempts to get the water displacing formula worked out. So water displacement perfected on the 40th try, hence WD-40.
Gosh, that's really, really good information. Thank you. We will not forget it. Huh? Dr. Evil. Preparation H. Shot. Not many people know Austin Powers. Oh,
It's one of my favorite franchises.
You know, it's really sad though. How many people in this generation know who Michael Myers is? Sean? Is Myers from Canada?
He is very Canadian.
Jim Carrey. Wasn't Jim Carrey Canadian?
Also very Canadian.
Jesus, man. Jim Carrey is my favorite. The best comedian ever. I know people think Carlin is the best, but I think Carrey is the best.
My favorite's Chris Rock.
Are you freaking kidding me? Chris Rock? The guy's barely funny. Sean? No, I mean, he was funny in, what the hell was the movie? Was it Rush Hour?
Oh, that was Chris
No,
Tucker.
That's Chris Tucker. No, Chris Rock was in,
Head of State was funny.
How Much for One Rib? Like, he was trying to buy ribs, and they're like,
Oh, I know.
What?
I think that was a Spike Lee movie. I forgot the name of it.
was it?
I think. Don't quote me. It sounds very familiar. I know what scene you're
Was
talking
he in
about.
I'm Gonna Get You, Sucker?
I think so.
Because if he is, then that's the movie it was in. I don't think so, though. No, maybe it was Friday.
I'm checking right now. It was I'm gonna get you suckers. Keenan Ivory Wayans movie.
Right.
I thought it was Spike
But
Lee.
where did Chris Rock say how much for one rib? Like, he's like, how much for ribs?
Yeah,
You know,
it was that movie. Yep.
It was. Which
100%.
one? I'm Gonna Get You, Sucker?
Yep. 100%.
He was in it.
Yeah. 100%.
Nice. Good. Like, get out of here.
His character name was Rib Joint Customer.
Yeah, Rib Joint Customer. That might have been like one of his first movies.
It had to been.
One of the best movies, man.
Oh, we have a question.
Yes.
This comes from Bushra Ibrahim on YouTube,
Hello, Bushra Ibrahim. Welcome.
asking how successful is laser discectomy. I've had done it on my L4-5 to S1, but one of my discs has herniated even more within a month.
I don't know who did it, but there's only one laser disc surgery that works, and that's ours at Deuk Spine. So I don't think we did it, but I could be wrong. But you shouldn't have reherniated. It's a great question. The problem is, when you say laser disc surgery, nobody really knows what's being done, because there is no standard laser disc surgery. There's the Deuk laser disc repair that we perform, and it works very well. Reherniation is 1%, so 1 in 100 patients will reherniate in our patients. And usually because they're doing something they shouldn't be doing. So I don't know what you did or didn't do, or who did your surgery. It's a great question. I just don't know what surgery you had. There isn't, when you say laser discectomy, I don't perform laser discectomy because it's a procedure that doesn't work. All right, let's see. Shot. I think that's 5 right there, right? And then we got to do S1, which is below. We got 1 minute, Dr. Berndes.
And then we do the piriformis.
Yep. Shot. All right, we're going to end the live stream in 1 minute. If you have another question, ask it. But we're done with the facets. We're going to move on to the piriformis muscle next.
So did you guys know that
Shot.
Rock's brother is also a comedian?
No, I didn't know that. Any other questions, Henry?
At this moment, no current questions.
Go ahead and end the live stream.
Copy that.
And Shot. We're going to be back, folks, with a piriformis muscle release. This is a muscle in the buttock that gets torn quite often and causes horrendous pain. We're going to fix that for this gentleman.